some review before we get into something new. Yeah? I did some review yesterday, and it was very enlightening for me too, actually, to kind of put all the material together in different formats and such, right? So, we've learned about 3 systems of the body so far, right? But before I get to those, we kind of learned about levels of organization, which is like how atoms make molecules, make organelles, make cells, make tissues, make organs, make systems, make organisms. And then we started studying those systems, and we've studied 3 systems. So, I'm going to say it one more time because I'm going to come around and ask you guys, and I'm trying to give you a little heads up, about how atoms make molecules, make organelles, make cells, make tissues, make organs, make systems, make the organism me. Yeah?
Can you put that to a song?
Yeah, I like that. I like that. All right, that was funny, but now I'm going to call on you too. Miss Monreal, atoms make what that starts with an M?
Molecules.
Molecules make what that starts with an O?
Organelles.
Organelles, which are tiny cell organs. Organelles make what? Starts with a C.
Cell.
Cells. Group of cells together makes what?
Tissue.
Tissue. Tissues together can make a
organ.
Organs working together can create a
system.
A whole bunch of systems working together can create a
organism.
Thank you. That is the levels of organization. That was fantastic and perfect. No pressure for the next person I call on. Yes. Mr. Kandaris, your eye looks half open, so I thought I better call on you before you fall asleep. So, Mr. Kandaris, atoms make what that starts with an M? Molecules. Molecules make what that starts with an O?
Organelles.
Yes, organelles make what starts with a C?
Cells.
Yes, cells make what starts with a T?
Tissues.
Tissues make what starts with an O?
Organisms.
How about organs?
Organs.
Yep. Organs working together in a system make what? I think I just gave you the answer.
Yeah, system.
Yes. A group of systems working together makes a what?
Organism.
Thank you, sir. Miss Hunter. Miss Hunter, I am calling on you. And I'm just saying your name a couple times, Miss Hunter, because yes, because you know what we have to do. Yeah. All right, Miss Hunter. Miss Hunter, atoms make what?
Atoms make molecules.
Molecules
make organelles. Organelles make cells. Cells make tissue. Tissue make organ. Organ makes a system and then organism.
They grow up so fast. That was amazing. That's exactly what I wanted. Thank you so much. Awesome. Miss Cooper. Atoms make what?
Molecules.
Molecules make what?
Organelles.
Organelles make what?
Cells.
Cells make what?
Tissues.
Tissue makes what?
Organ systems.
Organs. Group of
organs.
Organs working together makes a what?
System.
Yep. Group of systems working together makes what?
The person.
Yeah, the organism. Damn, good job. Really good. Awesome. Okay. All right, I'm feeling pretty good about this. Miss Stanley, can you hear me now? Yeah? Let's test it. Atoms make what?
Molecules.
Yes, molecules make what?
Cells.
Organelles.
Organelles.
Yep, organelles make what?
Cells.
Yes. Cells make what? A group of cells together makes what?
Tissue.
Tissue. Tissue can then form into a what?
Organ.
Yes. Organs working together can create a...
Organ system.
Yep. And then a group of systems working together creates what?
Me.
You. And what?
Organism.
Thank you, organism. Both are true. Thank you. Fantastic. Okay, that was systems of the body. That was organisms. That's just kind of how we organize stuff, right? And then we had 3 systems of the body we've learned about so far, which is just our way of chopping up the body to understand it, right? The first one we learned about was the integumentary system. Miss Nguyen. Miss Nguyen, what?
Yeah.
What is the integumentary system?
Appreciation.
The integumentary system. What is it made up of? I'm calling on you because I actually asked you this earlier. So I have this bad habit. I will call on you over and over again until it's burned in your brain, like week after week. So the integumentary system is made up of my... I'm just going to scratch my skin and my hair with my nails right now while you think about it.
Oh, and the nail, skin, hair, right?
Oh, yeah! That's great. Awesome. Hair, skin, and nails. Yes. Some people weren't paying attention. What was the integumentary system again? What is it made up of?
Oh, in the nail, skin, hair.
Nail, skin, and hair. Got it. Okay. Ooh.
Yeah, thank you.
I'm getting kind of old. My hearing's a little bit off. What did you say again about the integumentary system? What's it made of?
Nail, skin, hair.
Awesome. Okay, cool. That's the integumentary system. Then we looked at the skeletal system, right? And the skeletal system was made up of what, Miss Harper?
Made up of bones,
Good. Always say that. Bones.
joints, and ligaments.
Yeah. Yeah, ligaments attach what to what?
Ligaments attached to bones.
Which is why they're in the skeletal system, yeah. Yeah, and joints, because the articulations, remember articulations are joints, right? Awesome. So again, what was that, just for clarity? What were the 3 things you said that make up the skeletal system?
The bones, ligaments, and the joints.
The bones, ligaments, and joints. Cool. Okay, awesome. Miss Felix Osuna.
Yes.
Okay, Miss Felix Osuna, let's review for everybody. What makes up the integumentary system?
It's skin, hair, glands, and nails.
Good. And, excuse me. And what makes up the skeletal system?
Bones, ligaments, and joints.
Yeah. And what makes up the muscular system?
It's the muscle, tendons, and what's the third one?
I don't know, actually. Muscle and tendon is what I would have said. Is there a third one, everybody?
I don't think so.
Yeah, muscle and tendon.
Did we say fascia yesterday, or is that just going to go along with?
Oh, muscle, tendon, and associated fascia. Associated fascia, the fascia that's around the muscle. Yeah, I love that. Okay, muscle, tendon, and associated fascia. Thank you, Ms. Monreal, for doing my job. I appreciate it. Okay, Miss Yanez. What makes up the integumentary system?
Hair, skin, and nails.
Thank you. What makes up the skeletal system?
Bones, joints, and ligaments.
Cool. What makes up the skeletal system? Oh, I'm sorry, the muscular system. Muscular system.
Muscle, tendons, and associated fascia.
Perfect. Fantastic. Thank you so much. Cool. Miss Torres. What makes up the integumentary system?
Skin, nails, and hair.
Cool. I realize the book also says associated glands. That means the glands that are in your skin. But I'm fine with your answer. It's perfect. Ms. Torres, what does the integumentary system do for me? Give me some stuff that it does. What's its purpose?
Protection. It regulates the temperature. Provides or creates vitamin C.
D.
It's a defense mechanism, and for sensory or sensors.
That was a really complete answer. Thank you. It creates vitamin D, though. D as in dog, not C as in cat.
Oh, great.
Yeah. Okay. But that was
Oh, vitamin D. Sorry.
D. Hey, how does it help regulate heat?
By sweating.
Sweating to cool you off, and the fat content keeps you warm. Yeah. So it insulates you, and it can also sweat to cool you off. That was wonderful, though. Thank you. Awesome, awesome, awesome. You're kind of on a roll.
I pay attention.
Good. Thank you. What does the skeletal system do for us?
The skeleton, same protection, support.
Structure, support, yeah.
It helps with the movements and blood cell production.
Yes, red and white blood cell production. Awesome. How does it help with movement? What do the bones do?
They move the muscle, or the muscle moves the bone.
The muscle moves the bones. The bones are the levers in your body. The bones are the levers in your body that the muscles pull on that make you move. Good job, though. Since you're on a roll, why don't you tell us about what the muscular system does for us?
The muscular system, it provides movement, protection, it helps with the posture, and it creates or helps with the temperature or
Yeah.
heat.
Yeah, it creates heat for sure. Yeah.
Thermogenesis.
Yeah, thermogenesis, heat creation. Wow. Okay. I think you summed it up really well. Helps with movement because muscles can only do one thing. What's the one thing they can do, Ms. Torres?
Contract.
Contract. Hey, what are the little contraction units inside the muscle cell called, the muscle fiber? Those little contraction units that are connected by Z lines.
Thin and thick filaments.
There are thin and thick filaments in these, yes, but we call these little units something. It starts with an S.
Is it sarcomeres?
Yeah, sarcomeres. Sarcomeres. That's fine. We'll take it. Beautiful. Awesome. Okay. That's great. Okay, so we've got three systems of the body. They all do really important stuff, and they all interconnect, right? They all interconnect. They don't exist on their own. We chop them up to understand them. Cool, cool, cool. So, let's talk about layers. So, Miss Hanson, I want to kind of combine what I know about the integumentary system and the muscular system because I know that there are layers of skin and fascia, right? So, let me move this for just a second. So guys, this is going to be me cutting down like into a leg. Through the skin though. So, I'm going to go through the skin. We're starting on my hairy leg, all right, on the skin. So Miss Hanson, what's this top layer of skin called?
Epidermis.
Epidermis. Epidermis. And what's the layer underneath the epidermis?
Dermis.
Dermis. And what's the layer under that?
Hypodermis.
Hypodermis is 100% correct. Give me another answer that's 100% correct. Epidermis, dermis. Subcutaneous?
Yeah.
Subcutaneous is also 100% correct. And what's the last one? What?
Subcutaneous fascia, is that what
Superficial fascia.
it is? Superficial fascia.
Okay. Now, we've gotten through all the skin. I'm going to start to run into a muscle here, right? So this was the 3 layers of the skin. And then I'm going to get to a muscle here. And what's the first layer around the muscle called? Around all those... Epimysium, yeah. And then what's the next layer called?
Paramycium.
Paramycium. And then what is the last little layer called?
Endomycium.
Endomycium. And there's a bone right here in the center of the leg. What fascia is around that bone?
Oh, that
Periosteum. We'll take it. Periosteum. That was very impressive. So she has just combined 2 different lessons together. Right? 3 in a way, because we talked about the integumentary system layers, the muscular system layers, and then we got to the skeletal system. And I'm doing this because these are all fascia layers that you guys will be rubbing through. I mean, not exactly, but you will be affecting all of them. Yes. Okay, so we had 3 layers of dermis, and then we had 3 layers of which is myo, which is muscle, 3 layers of mycium, and then we have this one thing of osteum. Osteo means bone. So I'm trying to put this in a way that will kind of make sense to everybody. You could say epidermis, dermis, hypodermis. Epidermis, dermis, hypo means under, hypodermis. Then you could say epimysium, top layer of muscle, paramycium, endomycium. And then you could say periosteum, which is the fascia around the bone, too. Peri means around. So with mycium, it's around these bundles of muscle. But, so we got 3 layers of dermis, 3 layers of muscle fascia. By the way, your skin is fascia, and fascia is your skin pretty much. Anyway, and then we got fascia around the bone, periosteum. That's a lot right there, what I just kind of went over. Yeah. Okay, so Ms. Hanson, really quickly, one last time for everybody before I go around and ask people questions. Let's just review. What's this top layer of skin called?
Epidermis.
Next layer?
Dermis.
Last layer?
Hypodermis.
Hypodermis. Some people call the hypodermis the superficial fascia, and pay attention everybody, because it is the top layer of fascia. It's above even this epimysium. So some people call it the superficial fascia, but it is hypodermis. And then we get to the muscle here. What's this layer called?
Epimysium.
Next layer.
Paramycium.
Last layer.
Endomycium.
And what's the layer of fascia around the bone?
Osteum.
Yeah, that's good. That's good. That's good for a Thursday morning. Periosteum. Cool, cool, cool. All right. Miss Bilotic. What is?
Yes.
Thank you. What's the top layer of skin called?
Epidermis,
Yes. What's the next layer called?
dermis,
Yep. What's the last layer called?
and then hypodermis,
That was absolutely fantastic. What's the top layer of muscular fascia here called?
epimysium,
Yes. What's this next layer called?
paramycium,
And what's the last layer called?
and then endomycium,
And then what's the fascia around the bone called?
paramycium,
Paraosteum. Osteo means bone. Think osteoporosis. That was absolutely fantastic. Thank you. Thank you, thank you, thank you. Miss Petrie. Top layer of skin?
So it's 3 layers.
Yep.
Epidermis, the dermis,
fascia around muscle?
And then the epimysium, the paramysium, and the endomysium.
And then what's the fascia around the bone?
Periosteum.
Yes. Thank you all. That was really good. Cool. Okay. So I think that covers, by the way, the majority of stuff that you'll need to know later in life about these things. I realize that was very general information, but it's good. We can talk about layers. We kind of have a general understanding of the integumentary system, the muscular system, the skeletal system, how they interact, all sorts of stuff. I'm very, very happy. Cool. All right. Let's do a quick review of bones and muscles we know so far. Bones and muscles we know so far. Do. Okay. Miss Nguyen. Miss Nguyen, what is this little bone here called? Right here, it's a collarbone, but we call it a...
Clavicle.
Yeah, really well said too. Clavicle. Thank you so much. Thank you. Miss Harper, what's this pizza-shaped bone back here called?
Or the scapula.
Yeah, so what was this one up here?
The clavicle.
Clavicle and scapula, beautiful. All right, thank you so much. Miss Felix Osuna, what's this bone here called? I'm not joking around. Humerus. Cool. Thank you. Miss Yanez, what is the joint called between my sternum and my clavicle?
The sternoclavicular.
Yeah. What's the joint called between my acromion process and my clavicle?
Acromioclavicular.
Yeah.
Right.
Yep. What's the joint called that's really kind of my shoulder joint between my glenoid fossa and my humerus?
Glenohumeral joint.
Yeah. Very cool. Thank you very much. Miss Monreal, what's this joint here called that's right in here between my sternum and my clavicle?
Sternoclavicular joint.
Yeah, very well said. What's the joint between, I'm not saying it is nice now, what's the joint between my collarbone and my shoulder blade called?
I know it just hold on.
No, it's hard because now I'm not giving it away so much.
Okay, sternoclavicular joint.
This next one starts with an A.
Acromial clavicular joint.
Beautiful job. And what's this ball and socket joint called down here?
Glenohumeral joint.
Yeah, very nicely done. Thank you. Cool. Miss Cooper. Miss Cooper, what is this fossa called right in here? This is a fossa that this is the fossa that makes your glenohumeral joint. So what's this fossa called?
It's just the glenohumeral fossa.
Yeah, glenoid fossa.
Glenoid fossa.
Yeah, that's good though. Thank you. What's this process out here that kind of makes my shoulder pad? What's this?
The acromion process.
Yeah, and when I trace it down, it becomes what? What is this called?
The spine.
Yeah, spinous scapula. And what's the place on top here called? It's a fossa too.
The what?
I'm being Superman. What?
Spinous fossa.
I couldn't hear the first part.
Spinous fossa.
Supraspinous fossa, yes. Supraspinous fossa. What's the fossa underneath the spine called?
The subspinous fossa.
Starts with an I. Infraspinous fossa. Yeah. Then what's the fossa called underneath the scapula? Just translate underneath scapula.
Yeah, that would be the subscapularis.
Subscapular fossa. Subscapularis is the muscle in there, but that's good. That's what I want to hear. Cool, cool, cool. All right. Miss Hunter. Miss Hunter, Miss Hunter, Miss Hunter. Miss Hunter?
Yeah.
So what, this is kind of hard to see because we're not, maybe I should give you a skeleton to make it a little easier. I'm going to take this scapula off the left side of the skeleton here and bring it closer to you. What border is this?
Lateral border. Oh, medial border, sorry.
No, don't be sorry. You corrected yourself and I'm super happy. Medial border. What border is this?
That's the lateral border.
Cool. What angle is this?
Inferior or infra?
Inferior. No, you got it right first time. Inferior angle. What angle is this up here?
Supra something?
Superior angle.
Super
Just
angle?
just
I mean, I know it has something to do with supra.
you're absolutely right. It's superior. It's just superior angle. Can you hear me?
Oh, superior, yes.
Cool. Superior angle. Okay. What's this thing called here?
Are you asking a question?
Yeah, I'm asking you what this is called.
The spine of the scapula.
Yes. What's the fossa called on top of the spine of the scapula?
Supraspinous fossa?
Yeah! What's the fossa called underneath it?
Infraspinous.
Yeah, infraspinous fossa. That's good. Infraspinous fossa.
Oh, fossa, yeah.
What's the fossa called underneath the scapula? What's the fossa called underneath the scapula?
Is that one the supra?
How about it goes underneath like those trains that go underneath the ground or those boats that go under the water?
Oh, it's like a submarine. Something.
What's this?
Oh, subscapularis.
Subscapular. It's the subscapular fossa, and the subscapularis attaches there. Yes, very good. Cool.
Oh.
You did good. These are a lot of words. You got the right idea. We're fine. Miss Stanley, what bone is this?
Looks like the humerus.
It is the humerus. Don't joke around with me. All right. Now, I have not asked these questions to people yet, any of you yet, so this is a little bit harder. Do you know what these things on the side are called down here by the elbow?
I don't know why, but I want to call it a cubital.
Not bad, actually. How about condyles or epicondyles? Condyles are kind of like this thing, epicondyle, the pointy parts on them, but anything down here. So condyles or epicondyles. The one on the medial side is called a what? Just put medial with...
Medial epicondyle?
Yeah, medial condyle, medial epicondyle. Cool. The one on the other side is called what?
The lateral epicondyle or condyle?
You nailed it. Yes. Cool. There are two tubercles up here.
The greater and the lesser?
Thank you. The greater is lateral, the lesser. Hey, there's a groove between the two. Do you know what the groove is called between the two tubercles?
The something tubercular groove, I think.
That's good, actually. And some people call it the bicipital groove because one of your bicep tendons go through there. Interturbicular groove. If you guys know what interstate transport is, it's somebody going between states, interstate transport. It means between. So interturbicular groove. Yeah.
Interturbicular groove.
Awesome. Thank you. That was not easy because we haven't done that yet. Mr. Kandaris, sir. What bone am I holding up here?
Humerus.
Yes. What are these things on both sides down by the elbow here?
Lesser tubercle.
No, down by the elbow down here. These kind of things on the side.
Is one your olecranon process?
Actually, that's not bad. Your olecranon process is your elbow, and it comes from your humerus, but it is down here. It's right down here. These are your condyles, or your epicondyles. So the one on the medial side is called what?
They're not both epicondyles.
They are both epicondyles, so I have to tell them apart somehow. So what do I call the one on the medial side?
The medial epicondyle.
Yes, that's correct. What do I call one on the lateral side?
Lateral epicondyle.
Yes, sir. There are two bumps up here on top, next to the head. There are two bumps up here on top, two tubercles. What are their names?
The greater tubercle and the lesser tubercle.
Yeah! There's a groove between the two. What are they called? What's the groove called?
I should just said it too. It's a fossa, right?
Nope. It's a groove. It's called a groove.
Okay.
It's the groove between the tubercles, like interstate transport goes between states.
Intertubercle groove.
Yeah.
Intertubercle
Interturbicular groove. Good job.
groove. Okay.
All right, everybody, that's good. I like all that. Cool, cool, cool. Miss Yanez, we're going to talk about muscles. Muscles. All right? I have not organized the information this way for you yet, but there are five muscles that we've learned about that help hold the scapula onto the back. There's lots of muscles that attach to the scapula and help hold it to an arm, all that kind of stuff. These are muscles that attach the scapula to the back or the scapula to the chest. They attach the scapula to the body and they lift it up, down, over, back. They all work together. There's actually five of them. So one is a big diamond-shaped one back here. What's its name?
The trapezius.
Yes, that's one. There's another one that looks like a Christmas tree. It's actually two muscles, but one name basically.
The rhomboids.
Rhomboids.
Major and minor.
Major and minor. Which one's on top? You know, when my daughter was younger, my minor, she used to like to ride on my shoulders everywhere. She loved it. And anyway, I'm sorry, I digress. Anyway, which one's on top?
The minor.
Minor's on top, cool. So we got trapezius, rhomboids. Then there's this funky muscle that attaches to the medial border also and goes up to the side of the neck here. It helps to elevate the scapula. What's that called?
The levator. Scapula?
Yeah, elevates the scapula, levator, scapula. Bam. You just hit all three in back. Those guys either adduct or retract or elevate or depress. They do stuff back here. Then we learned about two muscles that are kind of found in front. One actually inserts in the medial border of the scapula, but on the inside here, on the anterior side, and wraps around into your ribs. 8 to 9 ribs. What muscle is that?
The pectoralis major.
No. You're in the right spot though, so thank you. This one is saw-like. It's tooth-like. It almost sounds a little saw-like. And it's anterior. Starts with an S and it's anterior.
Serratus anterior.
You did great. Serratus anterior. And then there is one last one up here that attaches to the coracoid process of the scapula. When I'm hanging out with my homies, this is the one we like to talk about.
Is the pectoralis minor.
Pectoralis minor. Really good job. I've never asked the question that way. You did really good. So there are other muscles, I realize, people that go over to the humerus and move the humerus. There are muscles attached to the scapula that go to the humerus, like the rotator cuff muscles. But these 5 muscles that we just listed are responsible for moving the scapula around. The arm just comes along for a ride with these muscles, right? So let's review really quick. Miss Hanson, what are the 3 muscles in back that attach the scapula to the body?
The trapezius, the rhomboids, major and minor, the levator scapularis.
Levator scapula, beautiful. Then in front, we've got these kind of like eight or 9 ribs.
Serratus anterior and pectoral minor.
Pectoralis minor. Cool, cool, cool.
Pectoralis
Awesome.
minor.
Miss Monreal. Of those 5 muscles, which two help me to do an elevation of my shoulders?
Levator, scapula, and trapezius.
100% correct. She picked, by the way, the 2 muscles that are kind of running diagonal up here like this, and if they contract, they would pull my shoulders up. Levator, scapula, and the upper fibers of the trapezius, but she's 100% correct.
I always forget that.
No, I don't care. I just threw it in for extra information. I would have said trapezius too. It's fantastic. That's really good. Okay. Thank you. Miss Cooper. Of the 5 muscles that we just listed, what are the 2 that can help me elevate my shoulders? Elevate my scapula.
Would it be the levator scapula
Yes?
and the, I'm not sure of the other one.
Well, hold right there. Don't worry. I just asked this question to Miss Monreal, and I'm sure she'll tell us again. Miss Monreal, what are the 2 main elevators of the scapula?
The upper fibers of the trapezius and the levator scapula.
Cool. Thank you so much. Miss Cooper, what are the 2 muscles that elevate the scapula?
The levator scapula and the upper fibers of the trapezius.
Thank you so much. Anybody? Is there another muscle that can help, of these 5, that can help to elevate? We got the 2 main ones. Those are the main lifters. But there's another muscle that could be argued to help elevate the trapezius as well. Anybody want to take a stab at what that muscle might be? Anybody? Of the 5 muscles.
Rhomboids.
Why rhomboids?
Rhomboids.
Yes, rhomboids. Why rhomboids? Yes. Yes, they contract. But it's
Because they kind of go up.
yes, that's exactly the answer I wanted. Because they kind of go up. So rhomboids do help you pull back your shoulder blades, but they are running diagonal, and therefore they can help to lift them up. That is exactly the way I want you to think. So really, we could argue there's 3 muscles that can help elevate the scapula.
So when they're just in whatever state they are, which we're going to say they're doing nothing, but they're not really doing nothing, they're holding the scapula kind of in place.
Sure. The
would you
fascia.
say? And then when they contract, they could move it?
Yeah.
Is that,
Yeah.
okay.
The fascia in the muscle only lets it stretch so far, so they just kind of hang here. And then I know it's very confusing, but your body's never using one muscle at a time. It pulls different ones to get different responses, right? It uses like 5 at a time, and that's how it can choose whether this goes diagonal or this goes just straight across or whatever. But it is running diagonal. So we know that the scapula, because it runs diagonal, we know the scapula is capable of coming up and over, right? And I brought it up because I realized after I asked you the question and you answered it correctly that I really should have included the rhomboids, to be very honest with you. Cool. Thank you. Thank you, everybody. Okay. Can somebody name me 3 of those 5 muscles that help to depress the scapula, to pull it down. Which means you need some downward, at least angled fibers.
If no one else is gonna take a guess, I will.
Please,
Okay, lower fibers of the trapezius.
stop right there. You're 100% right. I just want to explain that. Those fibers go down like this, right? So if they pull down, they are definitely going to depress and help to adduct the scapula, but they're going to depress it. 100% correct, yes. What's the next 2?
Okay, I'm not sure, but the latissimus dorsi?
It's not one of the 5 muscles we talked about.
Now,
now-
one of the 5. Oh, I
Yeah,
thought you were-
but by the way, in a weird way, it would. We don't talk about it this way, but because latissimus dorsi pulls my arm so much, it would start to pull the scapula too. We don't
Okay.
talk about it
So
that way.
out of the 5.
Yes, one of the, yeah, there's 2 more of the 5. Anybody?
Somebody else guess. Or something.
Anybody?
Serratus anterior.
Serratus anterior.
Is the rhomboids one?
Serratus, hold on one second. The serratus anterior, yes, because serratus anterior runs at a downward angle. Now, rhomboids run at an upward angle, so I don't know how they pull down. I need something that goes down. Serratus anterior goes slightly down and front, so serratus anterior helps me protract, abduct, and depress. Yes. So what else goes down in front?
How about the capilla and slow fire?
The lower fibers, the trapezius, is 100% correct. Yes. And the serratus anterior is correct. What's the third one? What's the third one? What? What? Hold on. I'm so sorry. What was that, Miss Felix Osuna?
Pectoralis minor?
Pectoralis minor. Why do you say that?
Because it lies.
Because the fibers are going down. So it pulls your scapula forward and down. That's what it does. Yeah. Good job. Good job. Cool. Cool.
Wait, so what was that again? It was the lower fibers, serratus? No.
Yep,
No,
lower
it wasn't
fiber-
Serratus. It was,
Serratus anterior, lower fibers, the traps, and pectoralis minor.
okay. It was serratus.
Yeah,
Okay.
because it's not serratus' main job. Serratus' main job is to protract your scapula, but they do go down. They go down at an angle, so it can pull your scapula down too. Which is kind of a big deal, because your scapula, when you're doing pull-ups and stuff, once you get ripped off your body, you need stuff to pull it back down. So, last 2 questions. These are about protraction and retraction, or abduction. Remember, protraction is when the scapula moves more forward, this kind of stuff. And it is also abduction. The scapula is getting away from the midline. Retraction, you're pulling your scapula back, and it's adduction, adduction, because it's coming back to the midline. But anyway, who would like to tell me what 2 muscles protract or abduct the scapula? Protract or abduct. Do this. Get my shoulders come forward. Protract or abduct the scapula. Think where they'd have to be to get my scapula to go forward. What 2 of those 5 muscles?
Oh,
Go ahead.
the rhomboids?
Okay. So just really quick, these ones back here.
Oh, no, that's, wait, you said to protract?
Protract. I want my scapula to go forward.
Oh, okay. Then, is that gonna be, but it has to be of the ones we talked about, right?
Yeah. Major does not hook to the scapula.
Minor, pectoralis minor?
Definitely. It's in front. If it pulls, it can pull down, but it can also pull it forward. Sure. Yeah.
Okay.
That's one. Where's the second one?
Serratus anterior?
Yes. It's the main job of the serratus anterior. Serratus anterior and pec minor bring your scapula forward. Good. So what brings it back? What 2 muscles help to retract my scapula? Pull it back towards the spine.
Rhomboid.
Rhomboids is one. What's the second one?
Trapezius.
Trapezius. Which fibers?
Middle.
Middle. Absolutely, because they run across. Brilliant. You guys are doing really good. Really good. I know that some of it's still confusing, but you're doing really good. Like, I'm seeing truth, even if you're getting the answers wrong at times, I'm seeing true thought process going on of where it's like, okay, muscles contract, stuff like that. You're just still learning your muscles. Yeah? I feel like you have a question, Miss Petrie. Yeah.
So, let me just make sure I understand. The protract abduct of the scapula, right?
Protract is abduction, yeah. Because the scapula, it goes away from my spine, yeah.
So it's the pectoralis major and
Ma-
the serratus inferior?
Minor. The pectoralis major does not grab onto the scapula, so it can't move it.
Okay, so then to abduct or retract, we decided it was what? I'm sorry.
Well, what would be back here that would let me pull my scapulas back?
The trapezius,
Middle fibers, yep.
middle fibers of the trapezius,
And what's under the middle fibers, the trapezius?
subscapularis,
No, that's under the scapula. You're in the right area, but what's underneath the middle fibers, the trapezius?
rhomboid?
Yes.
Okay.
Rhomboids retract and elevate, but they retract for sure. When something's diagonal, it's moving in two directions if you think about it, right? If something's diagonal, if there's a muscle here, it's diagonal, as this thing travels up, it's traveling over. So we'd say it's elevating and adducting. If something's diagonal down there, we'd say it's depressing and adducting too. But anyway, yes. So just think about that with diagonal muscles. It's not clear. They're kind of going in two directions at once. Okay, that was really good. Yeah? I'm about to ask what the four rotator cuff muscles are. So a good way to remember these is SITS, S-I-T-S. Supraspinatus, infraspinatus, teres minor, and subscapularis. SITS. Yeah. Miss Stanley, I feel like you might know this because you touched your supraspinatus, I think, when I said this. What are your four rotator cuff muscles?
Supraspinatus, infraspinatus, teres minor, and
Subscapularis.
subscapularis.
Yeah, that was fantastic. Thank you. Mr. Kondaris, what are your four rotator cuff muscles?
Supraspinatus, infraspinatus, teres minor, subscapularis.
That's awesome. Thank you. Miss Cooper, what are your four rotator cuff muscles?
The supraspinatus, and the subscapularis.
Yes. I'm sorry. I think you were cutting out there, but I think I heard you. Supraspinatus, infraspinatus, teres minor, and subscapularis. Good job.
Yes, that's what I said, yes, but you cut out.
Yeah, I gotcha. I feel you. Miss Nguyen. Miss Nguyen. What? It's time for our practice today. What are the four rotator cuff muscles? What's the one on top here?
Suprapiner.
Supra?
Suprapiner.
You're absolutely right. I just want to help you pronounce it, but you're absolutely right. So supra, spine, atus. Supraspinatus. Supra, spine, atus. Atus. Yeah. Supraspine atus. Supraspine atus. Supraspine atus. Atus. Great job. What's the one underneath?
What underneath the minor?
Infra?
Here, right?
Yes, but it's underneath the spine of the scapula, so we say it's infra.
Intrapinal,
Yeah, infra,
infra,
spine,
spine,
atus.
itis.
Infra,
Infra,
spine,
spine,
atus.
itis.
Let's do the one on top again. Hold on. Look at me really quick. One on top again. Supra,
Supra,
spine,
spine,
atus.
itis.
One underneath. Infra,
Infra,
spine,
spine,
atus.
itis.
One on top again. Supra,
Supra,
spine,
spine,
atus.
itis.
One on bottom, one last time. Infra,
Infra,
spine,
spine,
atus.
itis.
And anytime I say infraspinatus, the next muscle you say is
Stena minor.
teres minor. Yes. So, Miss Nguyen,
Sup,
hold on. You said teres minor, I think, which is correct. So,
yeah.
ter,
Ter,
ease,
is,
minor.
minor.
Ter,
Ter,
ease,
is,
minor.
minor.
Ter, ease, minor.
Ter, is, minor.
Bam! Okay, last one. The one underneath the scapula is,
Subscapular.
yes, subscapularis. So,
But I remember you say in the four cup and they have one more muscle, but I remember before you said five.
no,
and
there's
I
four.
remember
There's
that.
four. There's four. There's only four. Four rotator cuff muscles, for sure.
Oh,
So don't worry, stop right there. But let's do subscapularis together. Sub,
sir,
scap. Oh, hold on. Let me think. I want to say this. Scap. Oh, that's a long word. Okay. Sub,
sir,
scap,
scap,
you,
you,
laris.
lur.
Sub,
Sir,
scap,
scap,
you,
you,
laris.
lur. Subscap,
You laris. Subscapularis. Good job. Okay. Cool, cool, cool. Okay. Miss Petrie. Miss Petrie, what are the four rotator cuff muscles?
The supraspinatus, infraspinatus, teres minor, and subscapularis.
Cool, cool, cool. Miss Harper, what are the four rotator cuff muscles?
Supraspinatus, infraspinatus, teres minor, and subscapularis.
Cool. Miss Hunter, Miss Hunter, Miss Hunter, Miss Hunter. Miss Hunter, what are the four rotator cuff muscles?
Supraspinatus, infraspinatus, teres minor, subscapularis.
Cool. One more question for you, Miss Hunter.
Mm-hmm.
All four of those originate. They have origins on the scapula. And all four of those insert into what bone? What bone do all four go to one bone? What bone is that?
Greater tubercle of the humerus.
That was even more. They all go to the humerus. Three go to the greater tubercle and one goes to the lesser tubercle. So you were getting like, you were answering a harder question. But they all hook to the humerus. You're absolutely right. Three go to the greater tubercle, one goes to the lesser tubercle. But that was really good. Fantastic. Okay. Miss Bilotic. Miss Bilotic, what are the four rotator cuff muscles?
The supraspinatus, the infraspinatus, the teres minor, and the subscapularis.
You're on fire today. Thank you. Thank you. Miss Yanez. What three rotator cuff muscles insert into the greater tubercle?
The supraspinatus, the infraspinatus,
Yep.
and the teres minor.
Yes. Which means what one inserts into the lesser tubercle?
The subscapularis.
Yes. Yeah. Well, no, let's ask you some more. So that seemed too easy. So, which one of those four muscles is responsible for an abduction of the glenohumeral joint?
The supraspinatus.
Yep, it's on top. It's got to lift the muscle up, so that's good. which one is responsible for a medial rotation?
The subscapularis.
Yep. Which two are responsible for a lateral rotation?
The infraspinatus and the teres minor.
Cool. Thank you so much. That was fantastic. Miss Torres. Miss Torres, what is this two-headed muscle called that's on the anterior side of my arm, this two-headed muscle in my brachial region?
Bicep brachii.
Biceps brachii, thank you. What is the muscle found on the anterior side of my forearm still? Does a flexion of the elbow still? It's underneath this one. Starts with a B too.
Brachialis.
You are absolutely right. So let's finish this up. What's the muscle found on the back side of my arm? Three-headed muscle. Triceps brachii, right. Which ones are responsible of those three muscles we just talked about? We just talked about biceps brachii, brachialis, and triceps brachii. Which ones are responsible for a flexion of my elbow or a flexion of my humeral ulnar joint? And I really appreciate the people who are thinking about it and moving their elbow right now. So that's awesome. But flexion, which one or three of those muscles or whatever helps me to do a flexion of my elbow? Ms. Torres. Biceps brachii.
The bicep and the brachialis.
100% correct. Thank you. That's exactly what I wanted to hear. Biceps brachii and brachialis are on the anterior side, so of course they help with a flexion going to the anterior side. Fantastic. Great answer. Great answer. Miss Hanson. Which of those three muscles, or which two, or which three of those muscles help me do an extension of my humeral triceps? Help me. Yes. Okay. Cool. Let's take a break there. That's a lot. Let's stop right there. Everybody, take a 5-minute break. We're going to come back and learn some new bones and things like that. But I hope you're pleased, because I was very pleased with that. We are really making, remember in the beginning, we are really making progress. Yes, your head still hurts, but we are really making progress. See you back here at 9:28. 9:28. It'll be great to share my screen with you. Boom. Okay. So, we're going to learn some new bones. We just learned the muscles that move the scapula and attach the scapula to the thoracic region of your body. And we learned the muscles that attach your brachia, your humerus, to your scapula. So we kind of have some basic understanding of kind of how my shoulder and upper arm, like how I get this kind of movement. We haven't done forearms or anything like that yet. Get that later. We're going to now take a look at the things that scapula attaches to. We call this area your spine and thorax. The spine and thorax region. So the spine is your spine, your vertebral column, and the thorax is anything with ribs, right? And your rib cage has several advantages to it. One is it does protect my viscera, which is my organs underneath. It's great for that. But your rib cage does something else really kind of cool. It is what your shoulders attach to. It allows you to move your arms around all this kind of stuff because they attach to your rib cage. And your thoracic region and your spine can do all sorts of amazing things. My spine can laterally flex. My spine can do a flexion. It can do an extension. It can do a rotation. My thoracic region itself, my ribs, can actually elevate and depress as I breathe in and out. They do elevate and depress my actual ribs as I breathe in and out. So there's all sorts of kind of cool stuff that happens in this area. And it's an area that actually has a lot of weight to deal with because if you think about it, your whole body's kind of balancing down on this, your whole upper body's balancing down on this lower back that has to support this kind of thing right here. Still here, good, okay. So, we're going to start to look at the spine and thorax, and this should be a big, big deal to you guys because the shoulders that we just covered and the back are probably the two most requested areas on the body to have worked. I think that there might be more important areas, but these two are the most requested. People always want their back rubbed, right? Always, always, always. So now we're going to look into what you're actually rubbing when you rub somebody's back and why. And this is what I think is very cool about studying anatomy and getting good about it as a massage therapist because it will make your massage better. And I mean that in two ways. One is it will actually make you be able to get better results for your clients because you actually understand kinesiology-wise how they go together. But it also literally makes your massage strokes better. If you know that there are certain muscles and where they're going and how to kind of access them, your strokes start to get more nuanced. Anybody can do a back rub. Anybody can do a back rub. You don't need to go to school to do that or whatever. And some people are actually even fairly good at doing a back rub. But people that understand anatomy do massage, right? When they're going up the back, they know what they're following, what muscles and all that kind of stuff. They're not just rubbing stuff. It's really nuanced. And so that's why we're studying this stuff. But before we get into the muscles of the back, we need to get into the bones of the back because all the muscles attach to all those bones. So today and Monday, we're going to spend time learning about the bones of the back, okay? I'm not too interested in the topographical view, but I do want to point out a couple of interesting things. Okay. Do we all see in the right-hand picture where it says spinous process of C7? Good. That is the bone. Spinous process is the bone that sticks out the back. You've got them all the way down your back. Spinous process is the bone that sticks out the back. You've got them all the way down your back. C7 is what we call a landmark because it's very easy to find. It tends to be the biggest bump you've got down here. C7 is one of the spinous processes in your neck that sticks out the most. Believe it or not, the one that probably sticks out the second most is C2. And there's a reason for that. These two are tied together. They're all tied together. But these two are tied together to help kind of control the curve of your neck. The curve of your neck. So C7 is the most prominent spinous process. But C2 is a close second, believe it or not. And you sometimes can feel C2 up here. Yeah, right up there. Yeah, and it's very prominent too. Not like C7. So those are important. You've got spinous processes all the way down your back. You should be able to feel these when you work on people. Yeah? And you try to avoid those. However, you try to avoid them, but you don't stay far away from them, do you? You want to usually quite often be very close to these. There are times when a massage therapist is just barely grazing these as he or she massages somebody. And we'll talk about why we're doing that and what muscles are in that area and what muscles are when you spread out from that area and all sorts of stuff. Cool. And back here, by the way, we also see the iliac crest. It's the back of your hips here. The iliac crest is your hips, really, your hip bone. But this iliac crest goes all the way to the back. And you can actually feel this on somebody when you're down by their sacrum and you feel two bumps on each side. That's the iliac crest poking up right there. And it kind of lets you know where your hand is. And I'll show you that with the bones here in a second. But I'm just trying to give you some things that I look for. If we look at the gentleman on the left-hand side who's facing us, you'll hear some people talk about this notch here. You have a notch between your two clavicles. A notch between your two clavicles. The two clavicles come together and they leave a little notch right here. And this notch is called the jugular notch. The jugular notch, your jugulars there. Your jugular notch. It's just a good thing to know. These are just things that massage therapists know. Like, they're stuff we talk about all the time. Jugular notch. It's right above your sternum. Some people say it's right above your manubrium. Your manubrium is your sternum. It's the top part of your sternum. Your sternum actually has three parts. We'll get to that in a minute. But this top part of your sternum is called your manubrium, and the jugular notch is between your two clavicles here. All right. Just some little things. We'll explain those more in a second. Okay. Let's talk about the spine. The spine. Let's talk about it. Hoping. Can everybody see my spine? Yep. You are looking at the spine anteriorly here, right now. You're looking at it head on. Okay? Let's do some things here. This is a skull up here, just the bottom part of the skull, the occipital bone actually. The occipital bone is back here, and it's the part of your head that actually sits on your spine. So let's talk about this spine because there's lots of interesting features to it. I'm going to turn our person around. They are now rudely have their back towards you. They have their back towards you right now. Cool? All right. Miss Felix Osuna, which vertebrae are these? This group of vertebrae. What do we call this group of vertebrae here? This beautiful purple group of vertebrae up here.
The cervical vertebrae.
The cervical vertebrae, the neck vertebrae, the cervical vertebrae. That's exactly right. The cervical vertebrae. Thank you. How many cervical vertebrae are there?
C1 to C7.
C1 to C7, so there's 7 of them. That's excellent.
Yep, 7.
No, you're right. You're fine. That was great. Thank you. All right, everybody. Here's some interesting features about the cervical vertebrae that you should know. There is 7 of them. The top one, C1, is often referred to as the atlas. Do you remember the picture of the guy holding the world up? He's like a Greek god, Greek titan or something. He's holding the world up, and they call that atlas. This guy's holding your head up, and C1 is often referred to as the atlas, the guy holding the whole thing up. So, Mr. Kondaris, what's C1 sometimes referred to as?
The spinous process.
Pay attention, sir. Miss Hanson,
Sorry.
what is C1 often referred to?
The atlas.
Atlas, the guy holding up the whole world. Mr. Kondaris, what is C1 often referred to as? Atlas.
Atlas.
Thank you, sir. All right. C2 is often referred to as the axis. That is because C1 actually rotates around C2. C2 has a strange little tooth-like thing that comes up, and C1 rotates around it. Rotates around its axis. So C1 is atlas, guy holding the world. C2 is axis, like an axle on your car, axis. It's what allows you to say no to me, right? So, Miss Torres, what's C2 called? Miss Torres?
Axis.
Axis. And what's C1 called? Did you hear me, Miss Torres? What's C1 called?
Atlas or
Atlas. Thank you. Cool. Okay. So, Mr. Kandaris, what's C1 called?
Your atlas.
Thank you. And what's C2 called?
Axis.
Thank you, sir.
Thank you.
Interesting stuff about these two. So, almost, not all, I'm about to explain that, almost all of your vertebrae have what's called a spinous process and transverse processes. The spinous processes you have felt on people. This is literally what you massage right here on somebody. Spinous processes you have felt on people, they stick out their back, right? The transverse processes stick out to the side and you have probably not felt them because there's muscle on top of them. They're like this, they're covered up like this. But they're called transverse processes. So if my nose was a spinous process, my arms would be transverse processes. They're very helpful. Later we're going to find out that muscles attach to them so that I can bend left and right like I'm doing right now. I want to make sure I'm telling you the truth here. Yeah. Every single vertebra on your back has has a transverse process. Every single vertebrae on your back has transverse processes sticking out the side. Every single vertebrae in your back except one has a spinous process. There is one vertebrae in your back that does not have a spinous process, does not have a spinous process sticking out. And it is C1. It is C1. C1 here, actually let's do this. C1 here does not have a spinous process sticking out right here. The other ones all do. The other ones all do. This is a side view here. I hope you can see. C1 does not have a spinous process. It's got two little tubercles there, but it does not have a spinous process. Anybody give me a guess why it does not have a spinous process? And all the other ones do?
Because then, I don't know, like, is it gonna get in the way of, it has to hook onto the skull, right? Or,
Well, what?
I don't know. Never mind.
Well, you were on the right track. You said it's going to get in the way of what?
I mean, of the, I forget what that thing is called.
The occipital? The occipital region or the occiput?
Yeah. So,
Yeah,
I mean, because doesn't it have to, like, pivot and move? So
Yeah.
would it,
It's more that you couldn't catch.
In a way?
You couldn't catch snowflakes. My head couldn't go back. My head would bump into the spinous process of C1. Yeah.
oh,
So you don't have one there because it gets.
oh,
It
you
gets.
know what I was thinking? I was thinking of the transverse. Well, which that makes sense too then.
It's
I
got
did
a.
not
It's
have
got
the
transverse.
transverse.
Everything's got a transverse. Everything.
It does? Okay.
Yeah. But only one thing doesn't have a spinous process, and it's C1. C1 is also known as what, Miss Monreal?
Atlas,
Thank you.
right?
Yes.
Okay.
Cool. All right. Then we've got C2, which is the axis, and C2 is your second most pokey outy spinous process here in your cervical region. And then you've got C7, which some people call vertebra prominens. Some people call this the most prominent vertebra prominens. Cool. Awesome. Okay. So, Miss Stanley, what group of vertebrae am I holding on to right now? This whole group of vertebrae, what are they called? You're muted.
I'm sorry.
That's okay.
Is it the cervical?
Cervical vertebrae. How many are there?
7.
Yes. What's the one at the top called?
Atlas.
Yep. And C1. What's the next one called?
Axis C2.
Thank you. What's the last one called?
C7.
Cool. Or vertebral prominence. Cool. What is the interesting feature about C1, the atlas? What's it missing?
What's it missing? I just know that it protrudes more and it's attached to.
No, not C1. C1 does not protrude more. C2 and C7 protrude more. C1 is missing something.
Yeah, I feel like you just said it too, and I'm like.
It's missing something so that my head can go back. It's missing a spinous process. It's missing the thing that sticks out the back. That's the answer. It's missing
That's the answer?
Yeah, it's missing a spinous process.
It's missing process. I wanted to call it the transverse thing.
No, because it's got transverse processes. Yeah. Okay?
Okay.
Okay. Miss Cooper. What is this group of vertebrae called?
That'd be C1 to C7.
Yep, what's the group called? What does the C stand for?
Oh, cervical vertebrae.
Cool. Which one am I holding on to right now? This one all the way at the top.
That's C1.
Yep, what's another name for it?
Atlas.
Yes. What's the second one down called?
Axis.
Yep, C2. What's the seventh one called?
Just C7.
Yep.
Cervical.
Or vertebral prominence. But yes, you're absolutely right. Cool. What is the interesting feature about C1 that makes it different from all the other ones?
Doesn't it kind of stick out more?
Hold that thought for 1 second. Miss Stanley, what is the interesting feature about C1?
It's missing the
The spinous process?
process, so you can't catch those things.
Thank you. Miss Cooper, what is the interesting feature about C1, the atlas?
It's missing the spinous process, but like why?
I think you missed that part of the discussion.
Yeah, I did, because I had that somebody was at my door. I typed it in the chat.
Yep. I'll have to find out from somebody else then. All right, Miss Nguyen. What is this group of vertebrae called?
Cadaver.
Yeah, sir.
And C1 and C1 and C7.
Well, yes, but the whole group is called your cervical vertebrae.
Yeah, cervical.
That's a hard word to say, huh? Cervical, you said perfect. Cervical?
Cervical.
Beautiful.
Yeah.
Ver. Te.
Tear.
Bray.
Bray.
Yeah.
Okay. I can talk now. Vertebrae.
Yeah, that was great. Cervical vertebrae. How many cervical vertebrae do I have? How many?
7.
Thank you. What's the top one called?
C1, but say
Atlas.
Atlas.
Beautiful. What's the next one called?
Axis.
That was fantastic. Axis. Good. What's the last one here called? See what? Just see what? 7. Good.
7 clavicle.
Yep. 7 cervical.
Cervical.
Clavicle's this here, but you're doing great. Okay. Cool. Awesome. Thank you, thank you, thank you. Let's see. Miss Balatic. Miss Balatic?
Yeah.
This next group of vertebrae are all in blue here. All of these have a rib associated with them. We're just looking at the spine, but these would, if on a real person, they used to have a rib coming out of it. So what's this group of vertebrae called?
The thoracic vertebrae.
Yeah, thoracic vertebrae. That's fantastic. Fantastic. Yes, thoracic vertebrae. Cool. How many are there?
12.
Yes. There are 12 thoracic vertebrae. Cool. That's it. I can't think of anything else to ask you about them right now. That's great. Thank you. Miss Hunter. Miss Hunter.
Yes.
Oh, cool. Miss Hunter. What is this group of vertebrae called here?
Hold on.
All got ribs
All
attached
right.
to them.
Can you repeat because you froze?
No problem. What is the group of vertebrae right here called? And it's a group of vertebrae that there's a rib attached to each one.
Is it the thoracic?
It is the thoracic. How many thoracic vertebrae do you have?
12.
Yes. How many ribs do you have?
12.
Yeah. 12 on each side, but yeah. Cool. What's this group up here called? A vertebrae all the way up here?
That's the cervical vertebrae.
How many do you have?
7.
Yep. What's the top one called?
Atlas.
Yep. C1 is Atlas. What's interesting about the Atlas?
Oh God! I know you just asked this question. It's missing something?
It is. Miss Cooper, what's it missing?
The spinous process.
Thank you. It's missing the spinous
Okay.
process, yes. Cool. Awesome. What's C2 called, Miss Hunter?
Axis.
Thank you. You did great. Thank you very much. Cool.
Awesome.
Miss Harper. Miss Harper,
Yes, sir.
what is this bottom group of vertebrae called?
The lumbar.
Lumbar. How many are there?
5.
You are exactly right. Yeah. Cool. What's the first lumbar called?
L1.
Yes. What's the last one called?
L5.
Thank you so much. Hey, what's this orange bone underneath the lumbar?
It's the sacrum.
Yeah. We haven't talked about this yet, but you know what the little tailbone is called down here?
Coccyx.
Yeah. Coccyx. Yeah. Coccyx. It's hard to say. Coccyx. Cool. That was fantastic. Okay, thank you. Miss Monreal. Which vertebrae are these?
Cervical,
Yes. How many?
7.
Yes. Which vertebrae are these?
Thoracic,
Yes. How many are there?
12.
Yes. Which vertebrae are these?
Lumbar,
Yes. How many are there?
5.
Yes. What bone is this down here? This big
Sacrum,
sacrum. What's this cute little bone off the sacrum called?
coccyx.
Yeah. Fantastic. What is the interesting feature about C1?
It is missing a spinous process.
Yeah. What is the purpose of it missing the spinous process? This is for you, Miss
So you
Cooper.
can tilt your head back and look at snowflakes.
Yeah, so you can catch snowflakes. So your head can tilt back and not run into the spinous process. Good. Thank you. All right. Awesome. Miss Yanez. Oh,
The coccyx, they
What?
don't count as like the lumbar. They're just completely separate.
I'm so sorry. Can you say that again?
The sacrum and the coccyx, they don't count as the lumbar.
They do not. Thank you for asking. In fact, if we refer to when you were a baby, your sacrum actually consisted of about 4 vertebrae that fused together to make the sacrum. And so we call the sacrum S1. And we call the coccyx the coccyx. But the sacrum, so the sacrum in some ways is like your last vertebrae in some ways. And by the way, here's how we talk about joints in the back, because every place between each one of these has cartilage and is a joint. It's a cartilaginous joint, right? So the joint between the last lumbar and your sacrum is called L5S1. Right? So,
I have a quick question.
please.
So you're saying the C7 has another name, cervical?
Oh, C7, your book doesn't say it. I was taught this, and I hear other therapists use it from time to time. C7 sticks out a lot. It's very prominent. And so some people call it the vertebra prominence. And I doubt it's in your book. Because when I went to school, we didn't have books. They just came out with stone tablets, and they didn't have the stuff written down. They didn't write a lot because it took a long time. Vertebra prominence, meaning the prominent vertebra, the one that pokes out. And I don't think that's a super important piece of information, but I tell you because it helps you communicate with other massage therapists and doctors and such. Yeah. Okay. And so, by the way, Miss Gianna, so like the joint between your neck and your thoracic region would be C7T1. If that makes sense. That way we can talk about every single joint along the way if we wanted to. So there is a T1, T2, T2, T3, T3, right? It's just like all the other joints in the body. So we we just label the two vertebrae, and that we're talking about the joint between the two. Now don't forget, every last one of these vertebrae and the sacrum have nerve plexes coming out the side. You see all these little yellow things sticking out the side here? They cut those. Those would be wires. They would branch out into smaller 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 wires. It really would branch out that many times. And that's how you can feel every little thing on your body is there's a tiny little wire going to it. I mean, they really branch out. Have you ever, anybody here do any planting where you plant a plant in a pot and you have to replant it? Have you ever waited so long that when you pull it out, the thing's just all roots around there? If we honestly could just pull your nervous system out, all the wires out, that's how it would look. You've got that many. They're microscopic and they're tiny, but there's that many. Because I can't feel, there's nothing on my body. When I take a little pin and hit something, the only reason I can feel that is because there's a nerve going right there. So think about how many nerves you have to have that no matter where you poke on your body, you can feel it. And there is no place in your body you can't poke that you can't feel. So you've got millions of nerve endings, and they all started from these bigger things here that branched out, branched out, branched out, branched out. So anyway, the only reason I'm making that big deal about that is if stuff gets pinched in here, in your sacrum, or in your lumbar region, or your thoracic region, or your neck, it can cause problems other places. Yeah? Do we remember what other places, depending on what region we're in? I love that face, Miss Giannis. She's like, I don't know. Not sure I remember. This is super helpful for massage therapists. It's not part of this chapter, but it's super duper. I mean, I use this all the time in massage therapy. In general, the nerves that come from my neck feed my arms. So, in general, some feed my face, by the way, but in general, if I started snipping wires in my neck, which I would never do, I would lose sensation and control of my arms. And that kind of makes sense. You can kind of see how they would go there, right? In general, the wires, the nerve plexes that come off my thoracic region, in general, those just wrap around my chest. Those just wrap around my chest. So the thoracic vertebrae, plexes, the thoracic nerves feed the thoracic region. So if I snipped those, I'd probably lose control of sensation in my chest and things like that. The lumbar ones, this is kind of important. The lumbar ones reach around my body and come down the front of my legs. So in general, lumbar feed the front of your legs, and in general, sacrum feeds the back of your legs. So this is important to me because if somebody comes to me with a problem and says, I have pain or lack of sensation, pain or lack of pain, right? I can't feel, or I'm having a hard time moving, or I have pain in the front of my legs, I think two things right away. I think you might really have a problem in the front of your legs. Don't ever underestimate that. You just might have a problem in the front of your legs. But you also could have a pinched nerve in your lumbar region. And if somebody has problems in the back of their legs, I might say, well, you might really have a problem in the back of your leg. You might really have a problem in your calf. You might. But you also might have a problem in your sacrum and the nerves there being pinched. That's possible. I would work on both because I wouldn't necessarily know at that time which both were. But to be a more thorough therapist, I wouldn't just, anybody could be like, I hurt here, and you're like, okay, you don't have to go to school for that. Always do this. Because even if the problem isn't there, it's kind of annoyed, and so rubbing it kind of helps that. But this might not be where the problem's coming from. Go back to the source and check. Like, rub this too. So when people have arm problems, I work their arms, but I always work their neck. Because it could be a lie. It could be a pinched nerve up here that's sending a signal down the line that's not true. Or a nerve cut off that's keeping a signal from going down the line that's not true. So neck, cervical feeds arms, thoracic feeds thoracic, lumbar wraps around to the front, feeds front of the legs, and sacrum trickles down the back and feeds the back of the legs. All right, cool. I love it. I think we did pretty good there. Yeah? All right, let's go check out another slide. Okay. We'll come back to this little guy here in a second. All right. Some of this stuff you know, some of this stuff you don't know, but you'll be able to figure out. That's really true. Okay. Boom. So, hopefully you can see the slide from page 171 of your trail guide book. We've got our collarbone up here. Yep, our collarbone. Miss Nguyen, what is this bone called here? My collarbone up here, what's it called?
Clavicle.
Clavicle, thank you so much. Awesome. The next thing we have here, everybody has a sternum. Tap your chest. Right there in the middle, that's your sternum. The thing when you were a little kid and your brother held you down and pounded on that, made you say the alphabet, whatever. That's your sternum. But your sternum has three parts. It's okay, anything on it can be called the sternum. But if you want to get more precise, there's a part of your sternum as you're coming up right at the end that angles back much more sharply than the rest. It's right up here, and that's called the manubrium. And there's actually a tiny little joint that barely flexes between the manubrium and the body of the sternum. What do you suppose we would call the joint between the sternum and the manubrium? Miss Yanis. What would we call the joint, just guess, between the sternum and the manubrium?
Sternomanubrial?
Yeah, sternomanubrial joint. She just said sternomanubrium joint. Sternomanubrial joint. Cool. Little joint between the two. Yeah. As you go down the body of the sternum, do you guys see where it says xiphoid process? It's spelled with an X. Xiphoid process. You should be able to find this on your body. You should be able to follow your sternum down and you will find a little weird thing here. On some people it sticks out, some people it sticks in a little bit, but you should be able to find it. And if you poke around it should not feel good. Have you ever been hit in the solar plex? This is where they're hitting you. This is your xiphoid process. It is an attachment site, by the way, for your diaphragm. Don't worry about that yet, but it's the xiphoid process. It actually can be snapped off and puncture a lung and things like that. Not by us just poking around, don't worry. You have to hit it pretty hard.
Yeah, someone told me once that you were to hit someone hard enough there, they could die.
Yeah, they probably could. It's not common, but you definitely could do some real damage. For one thing, hitting them there already is hitting them in their solar plex, and it's very effective. However, if you hit a little bit too high, all of a sudden you hit the sternum, and that's not too effective. But anyway, but yes, you can snap that off, and it can kind of puncture into the lung. Do not worry about that as a massage therapist. You're not going to push on it hard enough. But anyway, I want you to find it. That's your xiphoid process. It's the bottom of your sternum. So you kind of have the body of your sternum, the xiphoid process underneath, and the manubrium on top. Yeah? Manubrium, sternum, xiphoid process. Yeah? Yeah. Thank you, Miss Cooper, for nodding. I appreciate that. Miss Cooper, what's the top of my sternum called?
What, the manubrium?
Yes. What's the body of, what's the middle part called?
Is it just the sternum?
I'll take it. Body of sternum, sternum. And what's the last little pokey thing at the bottom called?
Oh God, is this the xiphoid process?
It is the xiphoid process. Awesome.
That's a fancy word.
It's awesome. Thank you. Cool. All right. Moving right along. Your ribs are sometimes referred to as costals. And it's an important word to remember because we will later learn about costal cartilage and all sorts of stuff. Costals is a common term used in anatomy for ribs, costals. So the joint between your sternum and your costals, might be called what, Miss Hanson?
The costosternal joint.
Thank you. I actually like that answer better than the one in the book. Why do I like that answer better? Because she did what I wanted her to do. She stuck the two words together. Most people say sternocostal. You said costal sternal. But don't even care. That's like the difference between saying 29th and Bell and 29th. So most people say sternocostal, and you said costal sternal. But you have the exact right idea. Sternocostal joints. Thank you. Yeah. There is some cartilage in your sternum. Down here, there's cartilage. That's why it flexes. So the joint between how do I want to explain this? Hold on. The joint between let me back up for a second. There's cartilage in here. And it's called chondral cartilage. And so this joint between the ribs and the cartilage is called costal chondral. Costal chondral. Because they're saying it's a joint between the costal rib and the chondral cartilage. Costal chondral. I just want to go over this so that when you're like taking a test on this later and you go back over and look at your book, it makes sense. But essentially they are labeling bones in your body, and they are giving names to any place that things intersect, because those are considered joints, even if they're barely movable joints, right? And that's how you get flex in your rib, and you want flex in your ribs. And don't forget, in this picture too is two things are really important. Between every single vertebra is a disc of cartilage. They're a joint there, right? Cartilage. And we call those intervertebral discs, the discs between the vertebra. Remember intertubercular groove, the groove between the tubercles? This is intervertebral discs, the discs between your vertebra. Most people just call them discs, but those are intervertebral discs. Now, this last thing is important. Everything's important in this book, but can we all see the orange down here? I hope. This is your sacrum, and this is your ilium. This bone here is called your ilium. This is your iliac crest. This is your ilium. Yeah. This joint between your sacrum and your ilium is called your sacroiliac joint, your SI joint. You will hear about sacroiliac joint for the rest of your massage life. I'll explain why in a second. Sacroiliac joint is the joint between your spine right here at the sacrum and your hips. Sacroiliac joint. And you can find this on people and actually kind of work it. We'll get to that. But that's from the back side. Here's the front side of the sacroiliac joint, right here. Whoop. Sacroiliac joint where the sacrum attaches to the hips. Sacroiliac joint. Sometimes referred to as the SI joint. You won't hear me refer to it that way a lot. By the way, most massage therapists, that's all they call it, SI joint. I don't use that a lot when I'm teaching you guys because I want you to learn sacroiliac. It's very easy to switch to SI. But I want you to forget what SI means. So that's sacroiliac joint. It's super important. Super important. This is usually when Miss Monreal says, please tell us why it's so important. But she's not.
Please tell us why it's so important.
Thank you, Miss Monreal. I'm so glad you asked. Okay. It is so important because if you think about it, if we look at our skeleton here, the entire upper body, everything, your head, your entire spine, your chest, your arms, all come down, all the weight of that comes down your spine and comes to your sacrum and hooks to your hips via the sacroiliac joint. The sacroiliac joint is the joint that connects your upper and lower body. I hate this example, but it's just it helps with anatomy. If I was dismembering you, this is the joint I have to get through to get your upper body separate from your lower body. It is the joint, the entire upper body rests on the sacrum. When I pick up a V8, the weight of that V8 goes down my arm. It's not magically floating. I have to hold up my arm. My arm's attached to my chest. That chest is attached to my spine. All the weight of that goes down my spine, down no other bones, straight down my spine. There's no other bones because the ribs disappear. Goes all the way down my spine, and it gets down to my sacrum. And the way that I'm able to hold this can up is I have to distribute that weight to the floor, and it goes out through my sacroiliac joint down both my legs. The sacroiliac joint attaches my upper body to my lower body.
So when people dislocate their hip, is that the joint that they do it at?
No, I'm assuming, by the way, it's pretty hard to dislocate your hip, but it does happen. You're absolutely right. I'm assuming they're talking about the ball and socket joint down here. Your sacroiliac joint can move a little bit. It's pretty hard to dislocate it because it's a fibrous joint and it flexes, but I don't think you could dislocate it without dying. They're talking about the ball and socket joint of your actual femur going into the hip, and we will get to that later, and it's fascinating. In my mind, actually, lower body is more important than upper body because that's your foundation. But still, the job, mechanically speaking, the job of my lower body is to carry around my upper body to places so I can pick up V8s and drink them and then have the energy to go some other place. My lower body is the car, and my upper body is the mechanical arms to do stuff when I get there. And this attaches the brain and the organs and the manipulating arms to the lower body that's the vehicle that runs me places and takes me places. And that's the sacroiliac joint. Attaches the upper body to the lower body. Miss Monreal, what is the joint that attaches the upper body to the lower body?
The sacroiliac joint.
Thank you very much. And it's the joint between the sacrum and the hips. Do we think, Miss Monreal actually, do you think that people get sore in that joint?
Do you mean like besides an injury, like generally?
Yeah.
Just people?
Yeah, is it an ache and pain area?
I mean, I don't see why it wouldn't be.
It is, yeah.
Because it supports so much.
Yeah. I hope you won't mind where I'm heading next. I don't think you will. You are the proud mother of children and the proud grandmother of grandchildren, right?
Yes.
Okay, and I'm assuming you did not adopt those kids, you birthed them?
Right.
Thank you, by the way, for, yeah. When you birthed them, these hips had to flex. And they kind of did that by opening up the pubic symphysis here. But what do you think that flexion did to your sacroiliac joint? It had to flex too. So for women especially, there's just lots of pressure here. Women actually have to go through bodily changes where their hips actually change and flex in that area too. So it's actually an area of high tension where your whole upper body's going here, but also it changes through childbirth. Athletics can put tremendous amounts of impact in it, all sorts of stuff like that. So it's a really neat place to work, and we will play with that later, actually getting into the sacroiliac joint. You can't truly get into it, by the way, it's sewn together, but you can get in there and kind of manipulate it. Very, very cool. Sacroiliac joint. Thank you, Miss Monreal. Cool. Let's get rid of this guy. Boom. Let's get this guy. Boom. Let's see. Okay. So that kind of gives you an overview of the vertebra and the hips. By the way, you don't really need to put this in your notes, but I just want to explain something for you later for when we get to the lower body. Your hips, when you were a child, were actually made of 3 bones. When you were a child, your hips were actually made of 3 bones. And they fused around this hole here, which is where your femur goes in. Your femur goes in here. Your leg goes in here. This is where people get out of joint. Miss Giannis, yeah. When you were a child, you had a bone up here called the ilium. You had a bone down here called the ischium, and a bone over here called the pubis. And as you grew, they fused together, and it became your hips. But because hips are so complex and have all these grooves and everything like that, we still talk about the ilium, the ischium, and the pubis. Yeah, that's true. Ilium, ischium, and pubis. So this is the sacroiliac joint, the joint between the ilium and the sacrum. But later when we get to lower body, you're going to hear me talk about the ischium and the pubis and things like that, because the hip is actually made up of 3 bones. You don't have to take notes on this. I just want you to understand why. You're going to be like, he's talking about this area again, but he's not calling it the ilium. He's calling it the ischium. Right now, if you're sitting on a chair, a hard chair, and you feel those bones you're sitting on your ischium right now. And you can actually touch, and I'm not being weird here, you can actually touch your pubis up here. It's above your reproductive organs. It's above your privates. There's a hard bone right there. That's this. You're touching your pubic symphysis right here, your pubic bone. Boom. Right there. So anyway, the hips are actually made of 3 bones. Ilium, ischium, pubis. We talk about the ilium a lot because you can feel it. I can actually feel this bone on people here, and I can usually feel their hip bone. And back here, you can feel these poking out by their sacrum. A lot of times when you think you're feeling their sacrum, you're actually feeling the back, the posterior crest of the ilium. I just want to let you know the hip's made out of 3 bones. You don't have to get too caught up in it right now.
What was the last one again?
Pubis.
Okay.
Think pubic, pubis. Ilium, ischium, and pubis. The ilium's the big one that kind of makes your hip bones that we think about, that you put your hands on, you know. Cool. And that ilium and the sacrum
They
come together.
sound like gases.
Gases?
Yeah, like helium and
Oh yeah! Like helium, yeah, they do. They kind of sound like that, yeah. Ilium, ischium, pubis. The pubis one's easy to remember because it's in front, pubic. Ischium's hard. Ischium's what you sit on. Ischium is in your tuschium. And ilium, iliac crest, ilium, all that stuff is your hip bones, the ones you really think of, that you can actually kind of see on people. Okay. Let's talk about the actual individual vertebra really quickly. Really quickly, vertebra. So, all vertebra, almost all vertebra, except for C1, have 3 or 4 similar properties, but they look different on the vertebrae. So, if you'll notice, your vertebrae start out small up here, and they get really big down here. Do we notice that? Why is that?
More mass to support.
Yes, right. It's a pyramid. You don't put your biggest block on top and your smallest block on the bottom, right? You need more and more support. This is why when people have back problems, if somebody comes to you and says, I've got a pinched nerve or I blew a disc, they'll always tell you, by the way, not always, 95% of the time though, they'll be like L5, S1, L4, L5. They're telling you the last couple of discs down here because where's the most pressure on your back? Down here. Because it's got all this above it. Right? The cervical vertebrae just hold the head. The thoracic vertebrae hold the head and the cervical vertebrae. The lumbar vertebrae hold the thoracic, the ribs, all that kind of stuff, and the neck and the head. So the lumbar vertebrae have the most pressure on them. So you'll often hear when people have disc problems, it's like L4, L5, L5, S1. That kind of stuff. That's very common. You'll hear those two all the time because that's where they get a lot of problems. Anyway, they all get bigger and bigger and bigger. And so as they get bigger and bigger and bigger, the components that make them change shape and stuff like that, but they all still have some things in similar. Like they all have transverse processes, right? The transverse processes get bigger as they go down, but they've all got transverse processes. They all have a body, believe it or not, a little bit, that they rest on. This one has to rest on a disc here and rest on the next body. The bodies get bigger. In the beginning, they're very, very almost unnoticeable, and they get bigger. They all have a vertebral foramen. Foramen just means hole. Foramen just means hole. It is a common anatomy term, and we are going to learn about lots of holes in the body. Your body has holes inside it. Vertebral foramen. Every vertebrae has to have a foramen because the spine has to go down through it. By the way, this is why massage is very safe. You can't rub somebody's spine. You'll have people come to you and be like, oh, I'm worried you're too close to my spinal cord. Your spinal cord is wrapped in bone. There's no way your therapist is getting to it. But there's a hole down through here that your spine runs through. And this is called the vertebral foramen, the hole that your spine has to go through. So, let me skip ahead on this slide for a second. Let's talk about a more basic vertebrae before we get to these. Cool. This is a thoracic vertebrae. But I argue all vertebrae are kind of like this.
You're not sharing your screen.
Oh, thank you. I'm like, I'm not getting the thing I want to get. Okay. Oh my gosh, that changes everything. Here we go. Do we now see a vertebrae? Thank you so much. So now I'm teaching. That's good. Okay. Do we see where it says the body on the right-hand side, body? Body, yes. That is this. It is the hard bone part. It is actually the anterior part of the vertebrae. Like if you reach through my chest and grab my vertebrae, you'd be grabbing the front here, the body, because the spinous processes go out the back, right? In my body, my vertebrae are like this, right? Spinous processes go out the back, body's actually in front. You'll never touch a body because it's inside my body. but I just want you to orient how you're looking at this vertebrae right now. You're looking at a top-down view, but the top of this slide, the body is anterior. You're looking at this. Actually, this is what you're kind of looking at. Okay? So the body is the part that rests on the disc, and there's another vertebrae underneath it that has a body, and it rests on another vertebrae, and this is just 2 vertebrae right here. This is probably 2 lumbar vertebrae because they're huge. Anyway, you've got a body, you've got the hole where your spinal cord goes through. What is your spinal cord essentially? Somebody give me a 5-year-old's explanation of what a spinal cord is.
Well, if you break it or tear it or mess it up, aren't you like paralyzed?
You are. So we've been using kind of an analogy for nerves and stuff like that. What's the spinal cord? You're absolutely right, sir.
Like the central nervous system?
Yeah, it is the central nervous system. But how do you explain that to a 5-year-old?
It's what makes your body function.
Pretty good. Yeah, what were you going to say, Miss Monreal?
So it's like the tree trunk, if the nerves are the branches.
Sure. I love that one analogy. What were we also talking about yesterday?
I don't know, but you're holding up a phone, so like send messages.
Yeah. Right. Where's the control center of my body?
Your brain.
Yep. A whole bunch of telephone wires come out, and all those telephone wires receive messages and give messages, and that's my spinal cord. Which is why Mr. Kondaris, by the way, is dead on accurate. You cut those wires, it's over. It's over for everything they were going to. And now that you know how the nerve plexes work, you know that if I cut them down right above my sacrum, I won't be able to feel the back of my legs or operate the back of my legs, but I'll still be able to operate the front. If I cut them right above my lumbar, I won't be able to feel my legs at all or use them at all. If I cut them right below my neck, I won't be able to use my chest and stuff on. My arms will still work because my cervical vertebrae feed my arms, right? Anybody know who Christopher Reeves is? Used to be Superman a long time ago. Poor guy got a cervical paralysis around C2. No arms, no nothing, and he can't hold up his own neck because he got broken so high. When somebody's paralyzed, it really does matter how high up they get. You want it to be as low as possible. So yeah, your vertebral column is the telephone wires running down there, and then they come out. They come out to go to various areas of the body, and that's why it's so thick. This is a whole group of wires. And they get smaller and 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 smaller until they're microscopic. Just like a big root. Just like Miss Monreal was saying, like a tree. Your analogy is right too. All these analogies are right. I just want you to grasp what the spine is. Anyway, it goes down through the vertebral foramen, and little bits of it split off the sides. Little bits of it split off the sides. And then there are what they call facets here. Facets help your vertebrae stay together and not twist. So they can bend, but it helps them work together. And these are just called facets. This is a superior facet, and this is an inferior facet. It's just the place where they hook together. I'm just trying to make the pictures in your book make sense. You don't have to memorize all the words yet. But this is the facet above is the superior one. The one below is the inferior one. This inferior facet hooks into this superior facet. And that's how they hook together. These are thoracic vertebrae, so they also have, not these, the ones in this picture are thoracic vertebrae, so they also have costal facets. What do you suppose hooks onto costal facets?
The ribs?
Yes. Yeah, because they're called rib facets. Costal means rib. So costal facets are where the ribs hook in. You ever hear somebody say, I've got a rib out? It's not matching up that facet quite right. And it is very uncomfortable. Now, this is important to massage therapists. This is the spinous process. These are the transverse processes. Between the two is a groove. between the two is a groove. And you massage through this groove all the time. This is kind of the groove down the back next to the spine. This groove is called the lamina groove. You will need to know this, the lamina groove. We're going to talk about people talk about the lamina groove all the time. Massage therapists, you are going to massage the lamina groove probably more than anything on the body. The lamina groove. It is the groove down both sides of the spine here. It's a groove that's kind of created right here, the lamina groove. It's a groove that's created between the spinous process and transverse process. There's a groove right here on both sides. It's called the lamina groove. Some of your muscles actually sit in it. Yeah. You love your lamina groove massaged. Yes, you do. Yes, you do, actually. You want a massage therapist to actually get in as close as they can to the spinous process without annoying it. Because there's all sorts of important muscles in the lamina groove. Your spinalis is in there. We'll learn about that later. I argue your multifidi and rotatories are in there, and your transversospinalis muscles are in there. So there's a lot of big and small important muscles in there. And I care about big muscles because they're big and they do all sorts of big stuff. I care about small muscles because they often get tight and pinch on little things too. So I care about both for different reasons. Very cool. And there are layers to the muscles in the lamina groove. So you can actually get good at pushing the top layer out and getting underneath into there, and getting deeper into the lamina groove for somebody like Miss Hunter who really likes it, which is almost everybody, by the way. Everybody likes it. Okay. So lumbar and thoracic look very similar. Both have bodies. Both have a vertebral foramen. Both have this lamina groove. They have superior and inferior facets. They have transverse processes and spinous processes, right? It's the cervical vertebrae that look a little trickier. But they still have a body. It's just smaller. They have a vertebral foramen. They have transverse foramen, and that's for little spinal nerves to come out of your head to feed other little areas up here in your face and stuff like that. But they're still very, very similar. They still have a spinous process, still have a lamina groove, all that kind of stuff. The ones that look super funky are unfortunately C1 that does not have a spinous process. C1 does not have a spinous process. And C2. C2 has a little thing. Can you guys see the thing on C2 that says odontoid process? The odontoid process is, odontoid means tooth-like. Odontoid means tooth-like. It sticks up like this, and C1 sits on top of it, and that's how you rotate. That's literally half of my no answer is coming from my C1 and C2 articulating. Going around the odontoid process. I just want to explain to you why that thing's sticking up there. All right, let me click through this really quick. Okay. We're just about done here. We did a lot today because I wanted to review. I was very happy with how the review went. I hope you were happy to start to see like the stuff that you could pull off. That's an overview of vertebrae. The really important stuff to remember about vertebrae is they've got a body, they've got a vertebral foramen that lets the spine go through it, they've got a spinous process, they've got two transverse processes, and they've got a lamina groove. Spinous process, transverse process, lamina groove. Those are the three most important things because you will hit these things. You'll work with them. And things attached to them to help your body move around. Boom, boom, boom. Okay. Can we talk about ribs? Awesome. How many ribs do we have, Miss Stanley?
question because the true and false ribs.
Now, how many total ribs do we have?
24?
24. And we say 12 because we just deal with one side of the body, but yes, 12 ribs. You're absolutely right, by the way. There's 24 if we split them in half. Yes, I know what you mean. 12 ribs. Awesome. And every one of those 12 ribs is attached to a vertebra. And what are those vertebrae that they're attached to? What are the vertebrae called that all the ribs are attached to? What type of vertebra are they? Miss Hunter. Oh, sorry. Sorry, no, I'm sorry, Miss Stan. I saw that you were muted, so I thought, anyway. Miss Hunter, what are the vertebrae called that all the ribs attached to? What are those vertebrae called? What type of vertebra are they?
Thoracic.
Thoracic. How many thoracic vertebrae do you have?
Thoracic.
Yeah, how many do you have?
Is that correct?
It is correct, yes. How many do you have?
Okay. Oh, thoracic vertebrae. I say 12, but
You should say 12.
24.
No, don't say 24.
Okay.
The reason Miss Stanley was right is that off each thoracic vertebrae, right, there's a rib here and a rib here. So she was saying 24 ribs. I'm saying 12 because I'm counting them as sets. But anyway, 12 thoracic vertebrae, 12 sets of ribs coming off them. You are correct, Miss Stanley's correct, and I'm correct. Okay, cool. Thank you. All right, everybody. We already talked about the sternum. And the top of the sternum is the manubrium. The middle part's the body of the sternum. The last part is the xiphoid process. There are ribs that hook into your sternum and there are ribs that don't hook into your sternum. And so they give your ribs different names. You have 12 ribs, but they call the first 7 true ribs. The next, is it 7, 8? Oh, I didn't even put it that way. Wow. Okay. The first 7, sorry, there's just a little discrepancy. The first 7 true ribs and the last 5 false ribs. We'll explain floating in a second. Let me explain what makes a true rib or a false rib. Your ribs come merrily along here from your back, from the thoracic vertebrae, and then they hook into some cartilage here, and then they hook into the sternum. Ribs 1 through 7 have their own cartilage. If I take rib 1 around, it hooks into its own cartilage, goes to the sternum. Rib 2 hooks into its own cartilage, goes in the sternum. Rib 3 goes into its own cartilage, hooks into the sternum. 4, 5, 6, 7. 7 have its own cartilage and hooks into the sternum. Number 8, its cartilage goes into the cartilage of number 7 and then goes into the sternum. Number 9 goes in the cartilage of 8 and 7 and goes in the sternum. They don't have their own cartilage going directly to the sternum, and so they call them false ribs. They're not as strong. It's just a term they use. I'm not even sure I like this term, but everybody uses it. So your first 7 ribs have their own connection directly into the sternum, and so they're called true ribs. If you look at the bottom picture on the right, the other ribs, they connect into the sternum, but they do it by jumping on to the cartilage of number 7. The cartilage of number 7. They come up to number 7 and hook into that. They don't have their own cartilage going to the ribs, and so they're called false. Now, what your book and I slightly disagree on is I was always taught and have always taught that ribs 8, 9, and 10 are false. Because the last 2 don't hook to your sternum at all, and we call them floating ribs. So the last 2, 11 and 12, are back here, and they don't even reach around to the front, and they're called floating ribs because they float. They hook into the thoracic vertebrae, 11 and 12, but they don't even come around to the front. They don't have any cartilage at all. You can feel them on some people. You can actually feel the pokey end on some people. If you grab them from the side, you actually have to be a little bit careful because you kind of irritate them, because you'll grab the end of ribs 11 and 12. And those are floating. They're not hooked to the sternum at all, they're floating. So I would say first 7 ribs are true. Next 3 are false, and the last 2 are floating. First 7 have a direct connection. The next 3, 8, 9, and 10 steal the connection of number 7. And the last 2 ribs, 11 and 12, have no connection whatsoever to the sternum. None. Now, they call them floating, by the way, but just for your edification, they're not floating around loosely in your body. They are woven into the fascia back there. There are actually people, by the way, that get operations to remove their lower rib.
I have a question.
Yeah.
So if you have a different outlook on it, then is it just this person who wrote this book, this is their point of view of how they see the ribs?
Well, does anybody have, I'm sorry, I don't have my book open. Yeah.
Is there really a wrong or right way then?
Well, what I want to know is, I was always told the false ribs don't have their own connection to the sternum. What does your book say for the definition of a false rib? Does it have one? Should be around page 173. Anybody? Should say it's a false rib because blah, 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 blah.
They say it refers to a false rib because they attach indirectly to the sternum by the means of the costal
Yeah.
cartilage.
Cool. Thank you. Stop right there, Miss Hanson. Okay, Miss Petrie, I can answer your question now. In my opinion, this is a mistake in your book in this picture. Here's why I think it's a mistake. When Miss Hanson reads the description, it's the description I would give. False ribs don't have a direct connection to the sternum, but they have a connection. They share number 7's connection. And so I would argue that the floating ribs have no connection to the sternum, and this picture should show false ribs being 8 through 10. And I would think most other people would too, but it sounds like even your book does. It just didn't draw the picture the way they described it. That's my opinion. Cool? Cool. Yes. Okay. So, Mr. Kandaris, what are ribs 1 through 7 called?
True ribs.
Thank you. Miss Cooper, what are ribs at least 8, 9, and 10 called?
They're the false ribs,
Yep, what makes them false?
because they connect to the other ones.
Thank you. They don't have their own connection. Beautiful. Miss Monreal, what are ribs 11 and 12 called?
Floating ribs.
Cool, thank you. Miss Hanson, what's the top of the sternum called?
Manubrial?
Yeah,
Can you say that?
manubrium.
Manubrium.
Yeah, manubrium, cool. See, Miss Nguyen, it's not only you. All of us have a hard time saying these words. And I'm not trying to make fun of anybody, I'm just meant it's true. They're hard. Manubrium, cool. Miss Nguyen, what's the bottom pokey thing on the bottom of the sternum called? It starts with an X, but it sounds like a Z. Z. Zai. Yeah, we'll take that. Okay, so let's xiphoid process. Xiphoid process. Xiphoid process. Thank you. That's awesome. Cool. All right, everybody. I'm not going to talk about ribs themselves. They're just ribs. So, let's do this. Do we remember when we were talking about the skeletal system, who had lordosis and kyphosis? Did somebody have that when we did the skeletal system?
I have that.
You had that?
Mm-hmm.
Cool. Do you remember what lordosis is?
It was like more of an exaggerated curvature of the lumbar.
Yes, really well done. Thank you. That's what it is to most people, by the way. But some people call it hyperlordosis, which means this thing is curved in. So this is one of these confusing medical terms that different people use different ways. When you're looking at somebody from the back, if something curves in, that's lordosis. So your neck curves in, has lordosis, and your lower back has lordosis. Your thoracic region has kyphosis. It's just the way the curves go. Now, Ms. Monreal, I use it the same way you're using it, and most people do, where lordosis means it's an exaggerated curve. But also many people like this book also use it just to mean the normal curve. And so for them, the exaggerated curve is hyperlordosis. But the point I want to make to all of us is your low back curves in and your neck curves in, and we call that lordosis. Your back curves out, and we call that kyphosis. We can argue whether it's hyper or not, but the fact is there's a lordosis, and kyphosis. And again, most people, when they say I'm having lordosis, like it's a problem, they're talking about their low back curving in too much. But it can also just mean the normal curve in. Just want to make that point. We will go over that again. That's it. Let's stop right there. Okay, let me stop sharing. Oh, did it stop sharing automatically? Cool. Let's put this up here. Okay. Wow, that was a lot of stuff. We did review. We did the levels of organization. Remember that this morning, hours and hours and hours ago, when we made atoms turn into molecules, and molecules turn into organelles, and organelles turn into cells, and cells turn into tissues, and tissues turn into organs, and organs turn into systems, and systems turn into organisms. And then we talked about the systems of the body we've done so far. We talked about the integumentary system, and Miss Nguyen told us the integumentary system was hair, skin, and nails. And then we went on to the skeletal system, and that was bones and ligaments and associated joints. And then we talked about the muscular system, which is basically just muscles that can contract, although you have three kinds of muscles that can contract. You have your cardiac muscle, boom, 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 your smooth muscles that run over all your arteries and veins and inside of your muscle, and then your skeletal muscles, which attach to your skeleton. Your skeleton is really the levers of the body, and the muscles pull the levers of the body, and that's how you move, and that's kinesiology, and we talked about all that stuff. Then we reviewed all the muscles that we've learned so far, and we talked about the trapezius, the rhomboids, the levator scapula, the serratus anterior, and the pectoralis minor. Then we talked about the four rotator cuff muscles. We talked about the supraspinatus, infraspinatus. Anytime I say infraspinatus, you say teres minor. Then we talked about subscapularis. Then we talked about the biceps, the brachialis underneath it, the triceps underneath that. And then we talked about the bones of the thoracic region. We talked about the vertebrae here. We talked about the ribs coming off. We talked about a really important joint down here called the sacroiliac joint. We kind of numbered stuff. We learned about the atlas and the axis, and we learned about the really neat feature that's missing from C1 that I'm going to go around and talk to you guys all about right now when I ask you what you learned today. And that brings us to the conclusion of our week. Yeah. And you will have 2 small assignments to do this weekend, not super big. And then we'll reconvene and talk about more of this on Monday. I'm hoping it'll be a lot of review by that point. That's why I kind of crammed all this down your throat now so that we could kind of come back and clean up the mess that I've created. Okay. That said, Miss Torres, tell me something that you learned today. Thank you, Miss Stanley, by the way. Tell me something you learned today, Miss Torres, or something you want to remember from today, or something.
Well, I learned a lot, everything. Specific, about
The spinous process that the first one doesn't have it, C1.
C1 does not.
And I did learn that C1 is also known as atlas.
Thank you.
The C2 is known as aces. I did not know that.
Good. C1 does not have a spinous process. It's the only thing does not have one sticking out, right? That's so I can bend my head up and catch snowflakes coming down or something like that. Look at birds flying over the top, whatever. And C1 is called atlas. C2 is called axis because it rotates around an axis. Beautiful. Thank you very much. Miss Felix Osuna, tell me something else you learned today, or I can ask you a question. Either one.
Today we learned new bones and new joints too.
So tell me something specific.
We learned the ribs.
Okay. So,
The floating ribs.
okay, what makes a true rib a true rib?
I guess because they're attached to the right sides.
They have their own attachment to the sternum. How many true ribs are there?
There's let me check. There's 7.
Oh, 7. Good. Thank you very much. Miss Bolotic, tell me something.
I thought it was interesting that different parts of the spine was grouped. And that I was kind of expecting for all the little parts of the spine to have names, but they're all just numbered. So I thought that was nice.
It is nice. The only 2 that have names are really, well, C1, C2, maybe C7. But anyway, so they're in groups. What's this top group called?
The cervical,
What's the middle group called?
the thoracic,
And what's the last group called?
the lumbar.
Thank you so much. Miss Hunter. Miss Hunter. Miss Hunter, tell me something you learned from today.
I learned about floating ribs. I've always heard that term, but I never really knew what that meant.
What does that mean?
I don't know. I guess, I learned about it, but I don't know how to, say it. I'm assuming it just does not attach to the sternum.
That's it.
Or not the sternum,
No, stop. You just said it. They come from the spine like all the other ribs, but they do not attach to the sternum at all. They are floating.
Okay.
Yep. They're basically only in back. They don't even make it around to the front. Yes, thank you. Floating ribs do not attach to the sternum at all. Thank you. Miss Harper. Hi, Miss Harper. Tell me something from today.
I find it interesting about the sacroiliac joint.
The sacroiliac joint. I was waiting for somebody to mention that. Yeah, this spot right down here.
It's like how important it is that it connects to our upper and lower body.
Yes, so it's super important because it connects. It is the joint, the only joint that connects our upper body to our lower body. And think about it, everybody. When you stand on one leg, everything has to go through just one side of your sacroiliac joint too. It has to shift and do all sorts of really neat stuff. Thank you. Perfect. Miss Yanez, tell me something, or I can ask you a question too. It's up to you.
I learned that each part of it has nerves running to different sections of the body.
Yes. Where do the cervical region feed?
To your arms.
Thank you. Where's the thoracic region feed?
To your chest.
Thoracic region. Yeah, beautifully said. Where does the lumbar region go?
To the front of your legs.
Yes. Where's the sacral go?
The back of your legs.
Perfectly said. There are a couple of tiny exceptions to that when we get really nitpicky, but that's a really good, that will serve you well for the rest of your life. Miss Stanley, something from today, ma'am.
So mine's kind of similar to what Miss Harper said. I really thought it was fascinating that the SI joint kind of expands in childbirth and stuff.
Yes. That is actually an
and,
important thing to know.
And there was 3 parts of the basically the hips. There was iliac and ischium and pubis.
That's it. Stop right there because that's beautiful. The hips are made out of, you're absolutely right about childbirth and the stress on the sacroiliac joint. And the hips are made out of three bones. Ilium, ischium, pubis. Well said. Thank you. Miss Petrie. Something from today.
I completely forgot that the bottom of the sternum is called the xiphoid.
Oh, the xiphoid process. Yeah, that's a good one. It's a good one. Xiphoid process. Thank you. Mr. Kandaris.
I learned that C1 and C2 are atlas and axis.
Thank you, sir. Miss Cooper, something from today.
Well, I learned that if you have neck problem, you probably have an arm problem.
Yeah, I can see that. Yeah.
Because it's like, don't the nerves kind of go like?
Yeah, that's exactly what they do. It's exactly what they do. And I actually like what you said. You put a finer point on it. If you have an arm problem, you might have a neck problem. If you have a neck problem, you are even more likely to have an arm problem because your neck feeds the arm for sure. Yeah, well said. I like that. But by the way, not always true. Don't assume that everybody that comes in that you're like it's just, but it's a good place to look. Yes, Miss Hanson, something from today.
That your iliac crest, the sacroiliac joint holds your body.
Yes, hold your upper body.
Yes.
Okay, Miss Nguyen.
I learned you stay in the Atlas about the C1 can look up about that, but
Yeah, Atlas, you're right. And C1, it does not have a spinous process, so you can look up. Good.
yeah,
And
axis, but I don't know axis. What are you doing?
Axis, C2, the one that lets it turn on its axis.
Oh, in the turn, yeah.
We use the term axis to mean something turns around an axis. It's like an axle on a car.
Yeah, thank you.
Thank you. And I believe I've got one person left. I hope I'm right. Miss Monreal? Miss Monreal? So you're last. Don't. Go ahead. Go ahead.
Sorry?
Go ahead. Go ahead.
I thought it was interesting that you said that in the children those bones
Ilium, ischium, pubis.
sacral area were not
Oh, the sacrum. If you look at the sacrum in your pictures in your book, it almost looks like a couple of vertebrae fused together, and it was.
No. That's not what I meant. The other ones.
The hip.
The ones that you said that there were 3 parts. Yes, to the hips.
The ilium,
That
the ischium, and the
that when
pubis.
The kids are little. They're separate.
Yeah.
And right, you did say that, right?
Yeah.
Did I get it right?
By the way, you are right, but I need to be very clear to you guys. Those might fuse while inside their mother, or they might fuse afterwards.
Okay.
I actually don't know the timeline for them. So
I still think it's interesting.
it is fascinating. By the way, basically kids have no bones and are all cartilage at some point during the gestation period while they're inside mom. And then they start to harden and become more bony as time goes on. Some of that happens while they're still, before they've been born. Some of that happens after, and I don't remember which and the timeline. But yes, they definitely were 3 separate bones. They definitely get fused together at some time in a child's lifetime. Yes. Ilium, ischium, pubis. Awesome. Did I miss anybody?
So I want to ask you in the you talk about in the bone in the whole on the body in the L5, right?
The whole body sits on L5. Is that what you mean?
Yeah.
The whole body has to come down and rest on L5. That's true.
Oh.
And L5 rests on S1, the sacrum.
Yeah. So I only want to know about that.
Okay. So
Thank you.
you're welcome. So again, listen to people. If you hear somebody who says that they've blown a disc or herniated a disc or something, they're talking about their back, ask them if they know which one. And I bet you 95% of the time they're going to say L5, S1, or L4, L5. They're going to tell you one of these 2 joints down here because that's where the most pressure is. Okay, everybody, it's 11 o'clock. You have been engaged. You have been inspired. You have been thinking. You have been trying. You've been answering. We came a long way. I saw it in the review. We are right on course. We're headed exactly where I expect. There is a review at the end of this course, too. Everything is going to come together. The sun is shining. The birds are singing. I hope you have a fantastic weekend. We'll see you here for lab. And I'm going to release 2 assignments that you need to do over the weekend, but you have till Monday morning to do those. And I'm always available if you need me, okay? Thank you all. I really mean it. Thank you. Thank you, thank you.